Hi guys, let's start with the question of the day. The question goes like, a woman came to gynae casualty at 38 weeks of period of gestation with decreased fetal movement count. Which is the next step in the management? A. Observation, B. Non-stress test, C. Biophysical profile, or D. Induction of labor. So for this question, first you all need to know about the daily fetal movement count. We have to explain daily fetal movement count to all the pregnant females in the third trimester. We have to tell them they have to count the daily fetal movement count by lying in the left lateral position post breakfast, post lunch, and post dinner. There should be at least 10 movements in that period of time. If there is decreased fetal movements count, we have to explain them to come to casualty immediately. So for this question, first you need to know about this what is biophysical profile, what is non-stress test. So non-stress test, NST means non-stress test. In this, we do this test during the antepartum when the patient is relaxed, that is not in labor. So the components of NST is fetal heart rate. The normal fetal heart rate lies between 110 to 160 beats per minute, and if it is less than 110 or more than 160 beats per minute, it means some fetal distress is happening. Second, beat to beat variability, that there should be a beat to beat variability and the value of it lies between 5 to 25 beats per minute. What is acceleration? There should be at least 2 accelerations of more than 15 beats per minute above the baseline, which should last longer than 15 seconds. Deacceleration, more than 15 beats per minute and it should last and less than 15 seconds. So these are all about the parameters which we see in NST. So for example, if a patient comes to you with decreased fetal movement count, first you have to do NST, that is non-stress test, for 20 minutes. During this non-stress test, we, like you can see in this image, we apply one transducer and we give a click like a pen. We give it to the female. Whenever she feels a fetal movement, she has to click the pen and an arrow will be made on the NST paper, and this machine is seen in labor rooms. At least 3 to 4 machines are present in a labor room, so that we have to continuously do NST of the patients. So this is all about NST that you need to know. What is CTG? CTG, as the name suggests, cardiotopography. Cardiotopography we do for the intrapartum monitoring. Cardio means fetal heart rate, topo means uterine contraction. So here we are seeing two things, that is fetal heart rate and also the uterine contraction. So that is why we do this during the intrapartum monitoring. So this is CTG. Now we have to explain about what are the types of deacceleration. So 3 types of deaccelerations are seen. First, early deacceleration, late deacceleration, and variable deacceleration. So this is the fetal heart rate and these are the contractions. So if the fetal heart rate, the dip in the fetal heart rate coincides with the highest peak in the contraction, so this is early deacceleration. A V type of dip is seen. It is seen during head compression. You can learn like HEEE, head compression, which is physiological, and for this the treatment of this is we have to just wait and watch. And there's a gradual decrease, the word will be seeing gradual decrease, and the dip, that is from the fetal heart rate when it starts to fall to when it is lowest, it is 30 seconds. Now what is late deacceleration? In late deacceleration, the uterine contraction is happening, but the dip, the fetal heart rate falls after the contraction has happened, that is late deacceleration. So in this, a U type of dip is seen. It is seen in uteroplacental insufficiency. So this is a major cause, uteroplacental insufficiency. What you have to do? As soon as I see or observe that there is some fetal drop is happening with the contraction, first I have to stop the oxytocin or the Synto that we say. We have to stop the oxytocin. I have to tell my intern or tell to put a 1 RL. That is, we have to give IV fluids, we have to put oxygen, and we have to stop oxytocin. And we have to put the patient in the left lateral position. Why left lateral position? So that more blood reaches to the fetus. So this is very important, and this is commonly seen in labor rooms, and we have to manage this very importantly. And what is variable deacceleration? Variables means that it is not coinciding with the contractions. So it is seen in the umbilical cord compression. In umbilical cord compression, this is very important, and it is the most dangerous type, I feel. In umbilical cord compression, we have to put the patient in the Trendelenburg position. Why Trendelenburg position? So that the head goes up and it stops, it is not putting it's on the fetal, on the cord. Then we have to, that is the same, elevate the presenting part of the fetus off the prolapsed cord. And the treatment is emergency cesarean section. There is nothing we can do. We have to just take the patient to the OT, and never attempt to push the cord back in. This is very important, very very important. So this is all about the types of deacceleration, and one question is asked you from this topic. Now this is about NST. One more pattern which we can see is sinusoidal pattern. So what happens in sinusoidal pattern? It is seen during fetal anemia. So what is when it is seen, like in vasa previa? What happens in vasa previa? That the fetal blood vessels start to leak. And second is RH immunization. So these patterns are important. So now the patient came. You did NST for 20 minutes. Now again you can see that there are NST is done for 20 minutes. Now again you can see that the accelerations, you are not observing two acceleration. Then again you have to do NST for 20 minutes. And even if then there is no accelerations in, then you have to do biophysical profile. So what happens in biophysical profile? So there are 5 elements. That is, non-stress test is done, fetal breathing movements are checked, gross body movements, fetal muscle tone, and amniotic fluid. So this is important. And one PYQ which is asked, what is modified biophysical profile? Modified biophysical profile means we have to check amniotic fluid index and NST. NST will tell you about any acute condition present in the baby, and AFI will tell you about any chronic condition. So this is all about the this question. So for this, let me check the answer. Yes. So what is the next step? For next step is non-stress test. First you have to do non-stress test, and again for 20 minutes. So yes, the answer is non-stress test. Thank you guys. See you tomorrow with another question.